This relatively short video was filmed inside the hyperbaric medicine department at the Hamilton General to demonstrate 3 primitive controls on the Sechrist 500A ventilator. The goal of this video is to explain basic setting features of a pneumatically controlled ventilator in an effort to support this new project partnership between Hamilton Health Sciences and Battlefield International. This demonstration highlights the important relationship between breath cycles and flow to achieve a desired volume of air delivered into the lung. This introductory video does not speak to important features of pneumatic ventilators such as external PEEP options, adjustable oxygen levels, or high-pressure pop-off safety features.
Hi there, it's Claudia and Dr. Davis, and we're just in the hyperbaric unit demonstrating the Sechrist 500A machine. So as you can see at the top, there's 3 dials on this ventilator. Dr. Davis will go over them, as well as we'll go through 2 patient scenarios. Okay, go ahead, Claudia.
Well, to talk about the Sechrist ventilation, we need to talk about the concept of the cycle of breathing. We have an inspiratory period and an expiratory period, the sum of which is the cycle length. The cycle length determines the number of breaths per minute. The size of the breath is determined by the flow, the inspiratory flow that the machine and the knob for that is there. This allows us to determine the volume of gas per breath. Minute volume is the number of breaths per minute times the tidal volume. And in the case of 20 breaths per minute with a 3 cycle second length, we have to adjust the flow rate to get 500 ml tidal volume, and the net 20 breaths per minute times the 500 mils tidal volume equals 10 liters per minute. In the case of the 5 liter per minute breath, we have 10 breaths per minute with a 6-second cycle length composed of 2 seconds inspiration, 4 seconds expiration. We've adjusted the lung volume or the tidal volume by turning up the flow rate as necessary, and the net volume per minute is 5 liters. So 10 breaths per minute times 500 mils is 5 liters per minute.
Okay, so I'll just show you what we've done here. So this is patient A. So our goal is 10 breaths per minute. We have a 6-second time cycle, 2 seconds inspiration, 4 seconds expiration. Here, the lung volume is giving us 500 mils, and we achieve that by adjusting that flow control, and that will give us a a minute volume of 5 liters. Our second scenario is that we want 20 breaths per minute. That would be a 3-second cycle time, 1 second inspiration, 2 seconds expiration. To maintain lung volumes of 500 mils, we're going to have to increase the flow on that, and that will give us a minute volume of 10 liters. So how we measure that here in hyperbarics is we actually have a Wright's respirometer that shows us the volume that's coming out. So right now that's 500 cc's or 500 mils that the patient is blowing out. Okay. So in a second we'll just demonstrate what if we want a rest rate of 20 and a minute volume of 10, what we need to do for that. Okay, so this is the last section of our video. We've now made changes so that we can demonstrate this patient with 20 breaths a minute to achieve a minute volume of 10 liters. So we'll explain what Dr. Davis did to the ventilator to do that.
So we again looked at the cycle length composed of inspiration and expiration. We chose 1 second inspiration, 2-second expiration, allowing for the importance of inspiration being less than expiration time-wise, preferring something of the order of 1:2 to 1:3 IE ratio. Now, when we change the cycle length, we have to adjust the volume flow knob to allow one to get the 500 mil tidal volume. And in doing so, we have 20 breaths per minute with a 3-second cycle length, and 500 mil tidal volume, giving 10 liters per minute.
Good. So what we did was we ended up taking the inspiratory time and we shortened it so that we allowed the ventilator to essentially operate quicker. We also played with the expiratory time to get that ratio of 1 second inspiratory, 2 second expiratory that you can hear right now. And then to get the volume that we needed, since we've made those adjustments, we played with the flow button, okay? And now we're getting exactly 10 liters a minute on our rights. All right, so hopefully that demonstrates the 3 knobs and how you set this guy. Thanks.